São João University Hospital Center is the largest hospital in the north of Portugal. Open since 1959, it is a reference hospital for more than 3 million people and provides 1,100 inpatient beds, serving almost 4,000 patients daily, in outpatient encounters and emergency admissions. To provide healthcare, patient history is of utmost importance, and in the more than 60 years of operation, the hospital archive has accumulated over 15 kilometers of paper records. Although the production of electronic patient records is high, the hospital receives paper documentation brought in by patients, ambulances, and transferred by other healthcare institutions. This documentation must be available 24/7, sometimes in a span of minutes, and must be retained permanently, according to national legislation. Patients' history can be important to diagnose patient descendants, or for health studies that can benefit the community. In 2016, the hospital and the Portuguese National Archives set out on a project to identify and adopt best practices for digital preservation in the context of healthcare. In 2020, a case study aimed for the legal replacement of paper-based records by digital surrogates was undertaken, and the result was the implementation of the Health Records Repository. We started with the pediatric patients, since these will be our future patients, but the solution is now being used for any documents requests from the clinical staff. Today, the Health Records Repository contains information about more than 120,000 patients, and more than 2 million digitized pages, accompanied by 3.5 million preservation event records. Gradually, hospital staff is giving up on using the paper-based records, since the archive digitizes the records on demand. The whole process of organization, scanning, quality control, and ingestion in the repository has improved the access to physical records in time, security, and data protection, since physical records never leave the hospital's archive. Paper records received daily in emergency services are promptly digitized and available in the repository in less than 8 minutes. Currently, the repository is serving around 1,000 downloads per week, a number which is estimated to grow as administrative staff is being trained and the system is rolled out to be implemented in other departments. A preservation plan for the repository has been developed, together with a procedure to periodically review and monitor the repository effectiveness to respond to the preservation plan's strategic objectives. During the project, we have learned that thorough and automatic quality control is essential, and we've developed a digitization Q&A tool for that purpose. A lot of effort was put into dealing with the daily critical human situations. In urgent situations, proper archival submission can sometimes not be taken diligently, and patient identification must sometimes be postponed. Unusual challenges for an archive and a digital preservation system, which require innovative approaches. The archive will continue to grow with time, receiving not just paper records, but also digital-born. Already, 3 legacy clinical databases were incorporated into the Health Records Repository. We hope we can serve as an example for others to do the same and contribute to improve the archives of healthcare.